Hello, we will be discussing pregnancy as it pertains to the body in a holistic, organ, and cellular view.
What is pregnancy? It is a term used to describe the period in which a fetus develops inside a woman's womb or uterus.
During these times, there's a slew of bodily changes occurring for both mother and fetus. For the purpose of this video, we will mainly be talking about mother's changes. The first thing to recognize is the trimester breakdown of pregnancy. 1 to 13 weeks gestation is considered trimester 1. 14 to 27 week gestation is considered trimester 2. And 28 to 40 week gestation is considered trimester 3. Holistically, we look at the body in trimester 1 with some symptoms. What is notable about trimester 1 is that it is the most critical trimester due to high chance of ectopic pregnancy and miscarriage. Ectopic pregnancy is where the pregnancy implants on the fallopian tube. These pregnancies are very, very, very fatal for the fetus and can be very harmful for the mother. Miscarriage can occur at any point in time, but trimester 1 tends to be the highest risk for miscarriage. In trimester 1, the symptoms and events occurring are that the sperm meets the egg. There are symptoms of ovulation. There can be some implantation bleeding. If in excess, the bleeding could be a sign of an ectopic pregnancy. Implantation bleeding may look like or be described as period bleeding or spotting. You could also have tender breast, changes in taste, changes in smell, fatigue, constipation, mood swings, morning sickness, which can stimulate cravings and or aversions to certain foods, frequent urination, headaches, gassiness or digestive issues, hormonal glow or acne, as well as belly and breast size increases. For trimester 2, there are another list of symptoms. The largest part of trimester 2 is that baby will be developing limbs and will be moving more and kicking, as well as trying to reach around and stretch out. The symptoms of this trimester are increased appetite, increased or decreased libido, energy level changes, darkening of the skin around the nipples, navel, armpit, and inner thigh, backache, pregnancy brain, which is something that denotes the forgetfulness of women who are pregnant. Stretch marks may occur due to the belly and breast increasing in size. Heartburn, edema, which is the swelling of the hands or feet due to water retention. Insomnia, hair and nail growth due to excessive nutrients. Dry and irritated skin on the belly due to the stretching. This can also be true of the breasts, as well as snoring. Trimester 3 is most known for labor and delivery, which can occur safely anytime after 38 weeks. In most cases, it can happen earlier, but there is cases where it goes longer than that, in which case a cesarean section might be necessary to get baby out. During this trimester, there are another plethora of symptoms, one of which is a symphysis pubis dysfunction, which is a weak and unstable pubic symphysis. There could be a yellow colostrum leakage from the breasts in preparation for milk and breastfeeding. Exhaustion, return of many of the trimester 1 symptoms, Braxton Hicks, which are fake contractions that normally go away when movement occurs, a shortness of breath, and dropping of baby into position, which is head down into the pelvic bone and butt up by the rib cage, an enlarged cervix, spotting, loss of a mucus plug, which normally occurs 2 weeks before labor, Water breaking is another large sign of labor and delivery in progress. There is a rule when it comes to waters breaking, and that is that the contractions should be 5 minutes apart, 1 minute long, and have occurred for at least an hour. It's called the 5-1-1 rule. On a more detailed view, we break down pregnancy in the organ systems and how they develop and change along with the mother and baby. In this section, there are a large number of things that occur. First is the uterus growing due to the implantation of the baby and the consistent growth of the child. The pelvic, colon, and small intestine get crowded upward and backwards. The bladder moves up, but not as much as the uterus, which straightens as it moves up. This can attest for many of the frequent urination symptoms that women complain about during pregnancy. Breasts are also changing to get ready for breastfeeding. Your heart has an increased cardiac output by 20% at 8 weeks gestation. Renally, your glomerular filtration rate and your renal vasodilation increase by 40 to 85%, and there's an increase in oxygen demand.
For the cellular breakdown of pregnancy, we will start with discussing that plasma volume increases progressively throughout a normal pregnancy. Pregnancy causes a 2 to 3-fold increase in the requirement for iron. Changes in the cardiovascular system in pregnancy are found and begin early in pregnancy. Labor is associated with further increase in cardiac output. There is an increase in the production of TBG by the liver, resulting in an increased level of T4 and T3. Insulin levels are increased in both the fasting and postprandial states in pregnancy. Fasting glucose levels are, however, decreased due to increased storage of tissue glycogen, increased peripheral glucose use, decrease in glucose production by the liver, and uptake of glucose by the fetus. There is also an increase in total serum cholesterol and triglyceride levels in pregnancy. Finally, pregnant women require an increased intake of protein during pregnancy. Amino acids are actively transported across the placenta to fulfill the need of a developing fetus.